If you look at your legs and you don't like what you see, you might need sclerotherapy. We recently headed out to the Vein Center to learn more about a great treatment option. Our veins carry our blood to our heart, and we all know how important that is, but some veins are just not as pleasing. They're the ones that the Vein Center right here in our area can help you get rid of.
Spider veins are easy to diagnose just by simply looking at the mirror or looking at your legs. They're the ones that people become most concerned with the most often.
But how do you know if you have spider veins versus the sometimes more painful varicose veins?
Actually, they're different from real varicose veins. Varicose veins are larger, they're a little deeper, they're not immediately visible in many cases. They're caused by reflux from the larger greater saphenous or lesser saphenous vein. We treat the two differently. The spider veins are treated usually with injections, with sclerotherapy. The larger varicose veins, we can treat those with laser ablation. We actually go inside the vein and close them off, and sometimes even do phlebectomies to remove them.
Dr. Snyder and all of the Vein Center vascular surgeons are at the top of their game when they perform surgeries, just like the sclerotherapy procedure.
If the spider veins are all that you have and we've determined that, well, then we would schedule you, or sometimes even on the same day if we happen to have time that day, to do injection sclerotherapy after explaining it to the patient what the potential issues are. One of the things I have to explain to people is it's not magic.
What Dr. Snyder means is if you're getting rid of your veins because you have plans to go to the beach next week, it doesn't work that quickly.
You get it injected, takes 6 weeks to kind of see how well we're going to do, and then decide how much and how many sessions that you might require. I tell people that I don't want them to exercise vigorously for a few days, because what I'm trying to do is clot this thing off. I'm trying to scar the walls of it together so that it will clot off and disappear.
It may not be instant, but if you come to the Vein Center for sclerotherapy, you'll see the results. Their board-certified vascular surgeons will walk you through everything to ensure that you feel like you're in good hands.
When a patient comes in, sometimes they don't know what they have, spider veins versus varicose veins. And a lot of times people think they got horrible veins when in fact it's fairly minor spider veins. So the first thing we do is make sure you don't have problems with your major veins, that you don't have reflux, that you don't have varicosities that need to be treated.
Now, there are 2 Vein Center locations in our area. You can reach them at their Belmead office at 615-269-9007, again 269-9007, or you can reach them at their Cool Springs location at 615-503-9895, again 503-9895. For more info, you can reach them at veinreliever.com.